Hello, welcome to our virtual auditorium. Today we're going to discuss a very common form of congenital heart disease. It's called a ventricular septal defect. Before starting, I'd like to introduce you to Ed. Ed, the avatar. Ed, take a bow. I think it's important to point out that this video isn't meant to replace the normal conversations that you will have with your child's cardiologist. It's also important to emphasize that this video shouldn't be considered as specific advice related to your individual child. Every child is as unique as they are precious. Before thinking about the issues that can occur in a child with a ventricular septal defect, it's probably worthwhile doing a very brief refresher on the healthy heart. You might find it of use to look at the video of the healthy heart in this video series. Briefly, the important points are that the heart really has two separate sides. The right side of the heart pumps blood to the lungs, and the left side of the heart pumps blood around the body. In general, there's no mixing of blood between the right and the left sides of the heart. The pumps that pump blood to the lungs and to the body are called the ventricles. The wall between these two ventricles is called the ventricular septum. A ventricular septal defect, therefore, is a defect or a hole in the septum between the two ventricles. Ventricular septal defects are amongst the most common type of congenital heart disease occurring in our children. Sometimes ventricular septal defects occur as part of a more complex scenario, for example, tetralogy of Fallot, double inlet ventricle, or in the setting of transposition. But I'm not going to talk about these more complex syndromes. I would like to just consider the patient who has a ventricular septal defect as the only form of congenital heart disease. This is where Ed comes in. Ed is going to help me to explain what happens in a patient with a ventricular septal defect. So like any type of hole, a ventricular septal defect can be big or it can be small. It can occur in different parts of the ventricular septum, and some patients may have multiple ventricular septal defects. The main problem which occurs in a patient who has a large ventricular septal defect is that blood passes across the defect from the left ventricle to the right ventricle. This extra blood will then have to be pumped by the right ventricle around the lungs, so that as a result, there's a lot of extra flow to the lungs themselves. This also results in an increase in pressure in the lung blood vessels. Eventually, this blood will return from the lungs and re-enter back into the left side of the heart, putting extra strain on the left ventricle. In patients who have extra blood flowing into their lungs, what can then happen is that fluid collects in the tissues of the lungs, and this makes the lungs stiff. And this is the reason why oftentimes children with large ventricular septal defects can breathe faster than normal or tire easily, for example, when they're feeding. In this situation, sometimes your doctor might give you a medication in order to try and clear the fluid from your child's lungs. These are called diuretics. Sometimes your physician may prescribe another form of medication which is designed to reduce the amount of blood flowing across the ventricular septal defect. One group of these agents are so-called ACE inhibitors. But in general, we don't like to leave little babies with large ventricular septal defects for too long. They often have problems, as I said, with breathing and with feeding, and as a result, they may fail to thrive. As well as that, if you leave a large ventricular septal defect for too long, the high flow in the lung blood vessels can damage the tiny little blood vessels in the lungs. And obviously you don't want to leave strain on the left side of the heart for too long. So if your baby has a large ventricular septal defect, your physician may recommend that the defect is closed. And this procedure will often be recommended sometime before the age of about 6 months. In general, the most commonly used approach is a form of open heart surgery in which the ventricular septal defect is closed with a patch. Once the defect is then closed, there will be normal amounts of blood flowing around the lungs, and so as a result of that, your child should rapidly improve. In some children, particularly those who have multiple ventricular septal defects, or defects that are down near the apex of the heart, it may be difficult to close them when the baby is very small. For this reason, sometimes a surgeon will perform an intermediate step in order to reduce blood flow to the lungs. They place a band around the pulmonary artery to constrict it and thereby reduce flow of blood to the lungs. At a later date, when the baby is a little bit bigger, the band can be removed and the defects closed. Until now, I've really just discussed the babies who have a very large ventricular septal defect. But something that's much more common is that children are referred to us usually with a heart murmur, and we find when we do an echocardiogram that they have a very small ventricular septal defect. In these children, there's not a huge amount of extra blood flowing through the lungs, and as a result, there's not a lot of extra strain being placed on the left side of the heart. And so under these circumstances, we'll usually leave these defects alone. Oftentimes these very small defects close spontaneously, but it's important to emphasize that even if they don't close, as they're not placing a lot of extra strain on the left side of the heart, they're not resulting in a lot of extra blood flow through the lungs, they can be often quite harmless. There's no reason, for example, why somebody couldn't win a gold medal in the Olympics while having a small ventricular septal defect. So under these circumstances, we usually leave the defects alone. And then we have some children who are somewhere in the middle. They don't have a very large ventricular septal defect, but nonetheless it appears that over months or years, the ventricular septal defect is associated with some strain on the left side of the heart. And so we will electively undertake closure of this ventricular septal defect later on in childhood. Oftentimes again this will be surgical closure, but in some centres it may be possible to close these defects using a transcatheter approach. There are some children who have relatively small defects, but we decide to close them for other reasons. The sorts of reasons that I'm talking about are, for example, a condition called aortic valve prolapse. And what this means is that the hole is very near the aortic valve. And what can happen is almost as if the aortic valve leaflet can sort of fall into the hole. And this can damage the aortic valve and make it leaky. In order to prevent ongoing damage to the valve, the surgeon will often close the ventricular septal defect and she will repair the aortic valve. Another group of children in whom we sometimes elect to close a ventricular septal defect are children who develop obstruction within the cavity of the right ventricle. This is called double-chambered right ventricle. And so in this condition, your surgeon may elect to close the ventricular septal defect and relieve the obstruction within the right ventricle. We hope that you found this video useful today as you discuss the ongoing management of your child with your cardiologist and other healthcare providers. Thanks so much for listening today. Ed, wave goodbye to the people.